Okay, it's part 2. Say hi.
Hi. Hi. Hi, Leah.
Hi, Lisa. Who are we watching?
Businesses did very well.
Nighty.
So, in some ways, we've got some data on which approach is more likely to create jobs and opportunity for
That's
America.
Obama, silly.
And
You know that.
the economy works best when
really
middle-class
love
families are
Obama.
getting tax breaks.
Who you
so
vote
that
for?
they've got some money in their pockets.
Poopy head.
Poopy head. Oh, that's messed up.
Country that we live in. That we can afford to do a little bit more to make sure we're not blowing
No,
up the
I
the president began this segment.
let
I
know why
So I
I
boo
boo boo boo boo boo.
the first word of that segment. I get the last word of that segment. I hope. Let me
Bye, white poopy head.
let me repeat what
Bye,
I said.
baby.
I'm not in favor of a $5 trillion tax cut.
Hey.
My plan is not to put in place
Dada.
any tax cut that will add to the deficit.
Dada,
That's point
you
one.
have to
So you
know
may keep
what I
referring to the $5
want.
trillion tax
Dada,
cut. but
you
that's
have to
not
know
my
what
plan.
I want.
Number two, let's look at history. My plan is not like anything that's been tried before. My plan is to bring down rates, but also bring down deductions and exemptions and credits at the same time, so the revenue stays in, but that we bring down rates to get more people working. My priority is putting people back to work in America. They're suffering in this country. And we talk about evidence.
How is that?
Look at the evidence of the last 4 years. It's absolutely extraordinary. We've got
This
23
part 2
million
sucks.
people
You gotta
out
be.
of work
I want you to
or
be in the
stop
video.
looking for work in this country. It's just,
Okay.
when the president took office,
You don't listen to nobody. Shut up.
47 million food stamps today.
Come here.
Economic growth this year slower than last year.
Hi,
And last year slower than the year before.
hello.
Going forward with
Oh,
the
slow.
status
Who
quo
cares?
is not going to cut it for the
I
American
want
people
you.
who are struggling today.
Just kidding.
That's
I
it.
know.
What? That's what I want. That's what we want.
Don't hit me.
That's what I want. Daddy, that's what I want.
I don't understand what you're saying.
Governor Romney,
Daddy,
go first because President went first on segment 1. And the question is this:
that's
what are the
what
differences
I
between the two of
want.
you?
What you watching?
Go about
Presidential debate.
tackling the deficit problem in this country.
Dada,
Well, good. I'm glad you raised that.
Mama,
It's a
what
critical issue.
I'm favorite.
I
I
think
spelled
it's
presidential
an
wrong
issue.
in the last video.
Yeah, poopy head.
I think it's frankly not moral for my generation to keep spending massively more than we take in, knowing those burdens are going to be passed on to the next generation. And they're going to be paying the interest
You're supposed to be
and the
watching this.
principal all their lives. And the amount of debt we're adding at $1 trillion a year is simply not moral. So how do we deal with it? Well,
Who do
mathematically,
you
there are
love?
3 ways that you can cut a deficit. One, of course, is to raise taxes. Number 2 is to cut spending.
love Barack
and number 3
Obama?
is to grow
Yeah,
the
I love
economy.
my
Because if more people work
Daddy,
in the growing
and I
economy,
had
they're paying
two
taxes,
daddies.
and you can get the
Yeah,
job done.
I want.
The president's
I deal with you.
I understand. The problem with raising taxes
I
is that it slows down the rate of growth.
video.
And you can never quite get the
Do you,
job done.
do you love Mitt Romney too?
And encourage economic growth at the same time. What
I
things will I
hear
cut
you.
from spending? Well, first of all, I will eliminate
Listen
all
to this.
programs by this test if they don't pass it. Is the program so critical it's worth borrowing money from China
Hello?
to pay for it? And if not,
Hello.
I'll get rid of it.
Mama.
Obamacare's on my list. I
Dada.
apologize, Mr. President. I use that term with all respect. Good.
Daddy.
Okay, good. So I get rid of that. I'm sorry, Jim. I'm going to stop the subsidy to PBS. I'm going to stop other things. I like PBS. I love Big Bird. I actually like you too. But I'm not going to keep on spending money on things to borrow money from China to pay for.
He's gonna get rid of PBS?
Number 2, I'll take programs that are
You don't say that.
programs, but I think can be run more efficiently at the state level and send them to state. Number 3, I'll make government more efficient and cut back the number of employees, combine some agencies and departments. My cutbacks will be done through attrition, by the way. This is the approach we have to take to get America to balance.
He's trying to cut out this country like he did all the businesses.
Unfortunately, he doubled it.
He's admitting it.
Deficits for the last
Pony
4
ride.
years. The
I want
president's put
pony
in
You want a
ride.
pony ride?
public debt almost as
Can we
much
wait
debt
till after
held
the
by
debate,
public
please?
as all prior presidents combined.
Thanks.
Mr. President, 2 minutes.
Oh.
When I walked into the Oval Office, I had more than $1 trillion deficit greeting me. And we know where it came from. 2 wars that were paid for on a credit card, 2 tax cuts that were not paid for, and a whole bunch of programs that were not paid for, and then a massive economic crisis. And despite that, what we've said is, yes, we had to take some initial emergency measures to make sure we didn't slip into a Great Depression. But what we've also said is, let's make sure that we are cutting out those things that are not helping us run. So, 77 government programs, everything from aircrafts that the Air Force had ordered but weren't working very well. 18 government programs for education that were well-intentioned but weren't helping kids learn. We went after medical fraud in Medicare and Medicaid very aggressively, more aggressively than ever before, and it saved tens of billions of dollars, $50 billion of waste taken out of the system. And I worked with Democrats and Republicans to cut $1 trillion out of our discretionary domestic budget. That's the largest discretionary budget since White Eisenhower. We all know that we've got to do more. We've also put a specific $4 trillion deficit reduction plan.
What day I did? I want to buy a baby.
$2.50 for every cut. We asked for $1 of additional revenue.
I want to buy a
as I
baby.
indicated earlier, by asking.
Man, I'm not gonna know who to vote for.
Very well in this country
Because you're talking.
to contribute a little bit more to reduce the deficit. Governor Romney earlier mentioned the Post-Citizen Commission. Well,
Okay.
that's how the commission.
I like that to be like
how we should move
talking.
forward suggested we have to do it.
I be upside down.
Spending cuts. And this is a major
I do like that.
Just say, don't cut out the freaking world. Don't cut everything out,
You
man.
know, when Governor Romney stood on a stage
Tell you
with
what I want.
other
Tell
Republican
you
candidates for the
not
nomination,
me.
and he was asked,
I want
would you
me
take
the baby
$10
baby.
of spending cuts
Let's talk
for
about not
just
see my
$1
two better than
of revenue?
my
And he said no.
two Baba.
Now,
Ah,
if you take such an
Bobby.
unbalanced approach, then schools and
I
education.
know her.
It means that Governor Romney talked about
Dada,
Medicaid
you show
and
me
how we
so
get to send it back to the states, but effectively this means a
Dada.
30% cut
Put
in the
it-
primary program
put
we have
it on.
for seniors who are in nursing homes, for
on.
kids who are with disabilities,
I have her.
and that is not a right strategy for us to move forward.
Well,
Eat up,
2 minutes.
Dada. Now you
What
hear.
about Simpson Bowles?
Dada,
Do you support
check
Simpson
me
Bowles?
out.
No.
Simpson Bowles, the president should have
Check
grabbed
me
that.
out.
Don't
No,
those are my
we need
nice
to support
headphones.
Simpson
Don't mess them
Bowles.
up.
I have my own
Dad,
plan.
I
It's not the
can't-
same as Simpson
I
Bowles.
can't
But
read
in
out
my
to
view, the
you.
president should have grabbed it. If you
You
want to make
don't
some
get that.
adjustments to it, take it, go to Congress, fight for
That's
it.
a car.
Made some
That's
adjustments
a
to it,
car.
and we're putting it forward before Congress right
That's
now.
a car.
$4 plan.
But you've been president 4 years. You've been president 4 years. You said you cut the deficit in half. It's now 4 years later. We still have trillion-dollar deficits. The CBO says we'll have a trillion-dollar deficit each of the next 4 years. If you're reelected, we'll get to a trillion-dollar debt. I mean, you have said before you'd cut the deficit in half. And I love this idea of $4 trillion in cuts. You found $4 trillion of ways to reduce or to get closer to a balanced budget, except we still show trillion-dollar deficits every year. That doesn't get the job done. Let me come back and say, why is it that I don't want to raise taxes?
I got
I
pie.
don't want to raise taxes on people. And
Don't need
actually,
it.
you said it back in 2010. You said, look, I'm going to extend the tax policies that we have. Now,
Then
I'm
no,
not going to
I'm
raise
not.
taxes on anyone.
Will be out.
Because when the economy's growing slow like this, when we're in recession, you shouldn't raise taxes on anyone. Well, the economy is still growing slow. As a matter of fact, it's growing much more slowly now than when you made that statement. And so if you believe the same thing, you just don't want to raise taxes on people. And the reality is, it's not just wealthy people. You mentioned Donald Trump. It's not just Donald Trump you're taxing. It's all those businesses that employ 1/4 of the workers in America, these small businesses that are taxed as individuals. You raise taxes and you kill jobs. That's why the National Federation of Independent Businesses said your plan will kill 700,000 jobs. I don't want to kill jobs in this environment.
Dada, take Kevin.
And that's
Eight, nine, Kevin.
okay?
8K.
So we've had this discussion before.
Now, think about the idea that in order to
That's
reduce the
that how
deficit,
you
there has to be revenue in addition to cuts.
There has to be revenue in addition to cuts. Now, Governor Romney has ruled out revenue. He's ruled out revenue.
Absolutely.
Okay, so
Look, the revenue I get is by more people working, getting higher pay, paying more taxes. That's how we get growth and how we balance the budget. But the idea of taxing people more, putting more people out of work, you'll never get there. You never balance the budget by raising taxes. Spain spends 42% of their total economy
Dada.
on government. We're now spending 42%
Dad,
of our
he's
economy
getting
in
now.
I don't want to go down the path to Spain. I want to go down the path of growth that puts Americans to work with more money
Daddy,
coming
I
in because they're
made
working.
you into my
But,
dog.
Mr. President, you're saying in order to get it, the job done, it's got to be balanced. You've got to have...
If we're serious, we've got to take a balanced, responsible approach. And by the way, this is not just when it comes to individual taxes. Let's talk about corporate taxes.
I
Now,
can't go
I've
out.
identified areas where we can
Dada,
right
go
away, make a
again.
change that I believe would actually help the economy. The oil industry gets $4
Dada,
billion a year
that time, go
in corporate welfare. Basically, they get deductions that those small businesses that Governor Romney refers to, they don't get. Now, does anybody think that
Dada,
ExxonMobil needs
I typed it
extra
up,
money
go.
when they're making money every time you go to the bank?
Dada, go with it.
Why wouldn't we want to eliminate that? Why wouldn't we eliminate tax breaks for corporate jets? My attitude is if you got a corporate jet, you can probably afford to pay full freight, not get a special break for it. When it comes to corporate taxes, Governor Romney has said he wants to, in a revenue-neutral way, close loopholes, deductions. He hasn't identified which ones they are, but thereby bring down the corporate rate. I want to do the same thing, but I've actually identified how we can do that. And part of the way to do it is to not give tax breaks to companies that are shipping jobs overseas. Right now, you can actually take a deduction for moving a plant overseas. I think most Americans would say that doesn't make sense, and all that raises revenue. And so if we take a balanced approach, what that then allows us to do is also to help young people, the way we already have during my administration, make sure that they can afford to go to college. It means that the teacher that I met in Las Vegas, a wonderful young lady, who describes to me, she's got 42 kids in her class. The first 2 weeks, she's got some of them sitting on the floor until finally they get reassigned. They're using textbooks that are 10 years old. That is not a recipe for growth. That's not how America was built. And so budgets reflect choices. Ultimately, we're going to have to make some decisions. And if we're asking for no revenue, then that means that we've got to get rid of a whole bunch of stuff. And the magnitude of the tax cuts that you're talking about, Governor, would end up resulting in severe hardship for people, but more importantly, would not help us grow. As I indicated before, when you talk about shifting Medicaid to states, we're talking about potentially a...
You're not paying attention.
30% cut in
Yeah?
Medicaid over time. Now,
Hey, you need to check my head. My hair's falling out.
it seems like a big deal.
It is.
When it
Look.
just is paper, numbers on a sheet of paper. If we're
It's
talking about
barely
a family
out.
who's got an autistic kid and is depending on that Medicaid, that's a big problem. And governors are creative. There's no doubt about it.
I
But they're not
got
creative
that.
enough to make up for 30% of
I
revenue
got
on
that.
something like Medicaid. What ends up
That
happening is
you
some
be
people
done,
end up
Daddy.
not getting help.
Jim, we've gone on a lot of topics there, and so it's going to take a minute to go from Medicaid, schools, oil, to tax breaks and companies going overseas. So let's go through this one by one.
Ow, ow.
The Department of Energy has said the tax rate for oil companies is $2.8 billion a year. And it's actually an accounting treatment, as you know, that's been in place for 100 years. And in 1 year, you provided $90 billion in breaks to the green energy world. Now, I like green energy as well, but that's about 50 years of what oil and gas receives. And you say Exxon and
You Dr. Daddy?
this $2.8 billion goes largely to small companies.
Dr. Daddy says,
If we get that tax rate from 35% down to
take some taxes and call me in the morning.
$2.8 billion is on the table. Of course it's on the table. That's probably not going to survive to get that rate down to 25%. But don't forget,
Daddy, please
you put
give me
$90 billion.
I'm listening to Romney real
50
quick.
years worth of breaks into solar.
You're live.
To
You're live.
Solyndra.
I think there's a rabbit in you.
And Enter1. I mean, I had a friend who said you don't just pick the
Dr.
winners, you
Laser.
pick the losers. All right. So this is not the kind of policy you want to have. You want to get America energy secure. The second topic, which is you said you get a deduction for taking a plant overseas. Look, I've been in business for 25 years. I have no idea what you're talking about.
You
I maybe
got
need to get
a
more
weapon
help.
on your head.
But the idea that you get a break for shipping jobs overseas
No,
is simply not the case.
you can go with
What
Daddy.
you have right now is a setting money to bring money from overseas back to this country.
You can
And
go with
finally,
Daddy.
Medicaid to states, I'm not quite sure where that came in except this,
You
which
can
is
go
I would
with
like to
Daddy.
take the Medicaid dollars, we go to states, and say to a state, you're going to get what you got last year, plus inflation, plus 1%, and then you're going to manage your care for your poor in the way you think best. And I remember as a governor, when this idea was floated by Tommy Thompson, the governors, Republican and Democrats, said, please let us do that. We can care for our own poor in so much better and more effective a way than having the federal government tell us how to care for our poor. So let's state, one of the magnificent things about this country is the whole idea that states are the laboratories of democracy. Don't have the federal government tell everybody what kind of training programs they have to have and what kind of Medicaid they have to have. Let states do this. And by the way, if the states gets in trouble, well, we can step in and see if we can find a way to help them. But the right approach is one which relies on the brilliance of our people and states, not the federal government.
So the
Still on the
bomb
economy on another part of it. All right? All right, this is segment 3, the economy. Entitlements. First answer goes to you, 2 minutes, Mr. President. Do you see a major difference
Daddy,
between the two of you on
I'm
Social
gonna
Security?
call you.
cookie?
You know,
No
I
way.
suspect that on Social
I'm
Security,
not pony
we've
ride.
got a somewhat similar position.
I'm not pony
Social
ride.
Security is structurally sound. It's going to actually tweak the way it was.
I'm not pony ride now.
Pony ride?
Yeah.
It is the basic structure
ride.
is sound. But I want to talk about the values behind Social Security and Medicare. And then talk about Medicare because that's a big part of our deficits right now.
You okay?
Some of you know helped to raise me. My grandparents did. My grandfather died a while back. My grandmother died 3 days before I was elected president. And she was fiercely independent. She worked her way up, only had a high school education, started as a secretary, ended up being the vice president of a local bank. And she ended up living alone by choice. And the reason she could be independent was because of Social Security and Medicare. She had worked all her life, put in this money, and understood that there was a basic guarantee, a floor under which she could not go. And that's the perspective I bring when I think about what's called entitlements. The name itself implies some sense of dependency on the part of these folks. These are folks who've worked hard, like my grandmother, and there are millions of people out there who are counting on this. So my approach is to say, how do we strengthen the system over the long term? And in Medicare, what we did was we said, we are going to have to bring down the costs if we're going to deal with our long-term deficits. But to do that, let's look where some of the money is going. $716 billion we were able to save from the Medicare program by no longer overpaying insurance companies, by making sure that we weren't overpaying providers. And using that money, we were actually able to lower prescription drug costs for seniors by an average of $600, and we were also able to make a significant dent in providing them the kind of preventive care that will ultimately save money throughout the system. So the way for us to deal with Medicare in particular is to lower health care costs. When it comes to Social Security, as I said, you don't need a major structural change in order to make sure that Social Security is there for the future.
We'll follow up on this. First, Governor Romney, you have 2 minutes on Social Security and entitlements.
Well, Jim, our seniors depend on these programs, and I know any time we talk about entitlements, people become concerned that something's going to happen that's going to change their life for the worse. And the answer is neither the President nor I are proposing any changes for any current retirees or near retirees, either to Social Security or Medicare. So if you're 60 or around 60-year-old, you don't need to listen any further. But for younger people, we need to talk about what changes are going to be occurring. Oh, I just thought about one. And that is, in fact, I was wrong when I said the President isn't proposing any changes for current retirees. In fact, he is on Medicare. On Social Security, he's not. But on Medicare, for current retirees, he's cutting $716 billion from the program. Now he says by not overpaying hospitals and providers, actually just going to them and saying we're going to reduce the rates you get paid across the board everybody's going to get a lower rate. That's not just going after places where there's abuse. That's saying we're cutting the rates. Some 15% of hospitals and nursing homes say they won't take any more Medicare patients under that scenario. We also have 50% of doctors who say they won't take more Medicare patients. We have 4 million people on Medicare Advantage that will lose Medicare Advantage because of those $716 billion in cuts. I can't understand how you can cut Medicare $716 billion for current recipients of Medicare. Now, you point out we're putting some back there to give a better prescription program. That's $1 for every 15 you've cut. They're smart enough to know that's not a good trade. I want to take that $716 billion you've cut and put it back into Medicare.
Dada, I want a pony ride.
Program if we need to improve it. But the idea of cutting $716 billion from Medicare to be able to balance the additional cost of Obamacare is, in my opinion, a mistake. And with regards to young people coming along, I've got proposals to make sure Medicare and Social Security are there for them without any question.
I bet you're beautiful.
I think it's
Dad,
important to have a
Dad, I want a pony ride.
You can pony ride in a little bit.
Okay.
And the essence of the plan is that we would turn Medicare into a voucher program. It's called premium support, but it's understood to be a voucher program. His running mate.
And you don't support that.
I don't, and let me explain why.
Again, that's for future people, right? Not for current retirees.
So if you're 54 or 55, you might want to listen, because this will affect you. The idea, which was originally presented by Congressman Ryan, your running mate, is that we would give a voucher to seniors, and they could go out in the private marketplace and buy their own health insurance. The problem is that because the voucher wouldn't necessarily keep up with healthcare inflation, it was estimated that this would cost the average senior about $6,000 a year. Now, in fairness, what Governor Romney has now said is he'll maintain traditional Medicare alongside it. But there's still a problem, because what happens is those insurance companies are pretty clever at figuring out who are the younger and healthier seniors. They recruit them, leaving the older, sicker seniors in Medicare. And every healthcare economist who looks at it says over time what will happen is the traditional Medicare system will collapse. And then what you've got is folks like my grandmother at the mercy of the private insurance system, precisely at the time when they are most in need of decent health care. So I don't think vouchers are the right way to go. And this is not my only my opinion. AARP thinks that the savings that we obtained from Medicare bolstered the system, lengthened the Medicare trust fund by 8 years. Benefits were not affected at all. And ironically, if you repeal Obamacare, and I have become fond of this term, Obamacare, if you repeal it, what happens is those seniors right away are going to be paying $600 more in prescription care. They're now going to have to be paying co-pays for basic checkups that can keep them healthier. And the primary beneficiary of that repeal are insurance companies that are estimated to gain millions of dollars back when they aren't making seniors any healthier. And I don't think that's the right approach when it comes to making sure that Medicare is stronger over the long term.
We'll talk about specifically about healthcare in a moment, but do you support the doctor system there?
What I support is no change for current retirees and new retirees to Medicare. And the president supports taking $716 billion out of that program. So that's number one. Number two is for people coming along that are young. What I do to make sure that we can keep Medicare in place for them is to allow them either to choose the current Medicare program or a private plan, their choice. They get to choose, and they'll have at least 2 plans that will be entirely at no cost to them. So they don't have to pay additional money, no additional $6,000. That's not going to happen. They'll have at least 2 plans. And by the way, if the government can be as efficient as the private sector and offer premiums that are as low as the private sector, people will be happy to get traditional Medicare, or they'll be able to get a private plan. I know my own view is I'd rather have a private plan. I just assume not have the government telling you what kind of health care I get. I'd rather be able to have have an insurance company. If I don't like them, I can get rid of them and find a different insurance company. But people make their own choice. The other thing we have to do to save Medicare, we have to have the benefits high for those who are low income. But for higher income people, we're going to have to lower some of the benefits. We have to make sure this program is there for the long term. That's the plan that I put forward. By the way, the idea came not even from Paul Ryan or Senator Wyden, who's the co-author of the bill with Paul Ryan in the Senate, but also came from Bill Clinton's chief of staff. This is an idea that's been around a long time, which is saying, hey, let's see if we can't get competition into the Medicare world so that people can get the choice of different plans at lower cost, better quality, I believe, in competition.
Jim, if I can just respond very quickly. First of all, every study has shown that Medicare has lower administrative costs than private insurance does, which is why seniors are generally pretty happy with it. And private insurers have to make a profit. Nothing wrong with that. That's what they do. And so you've got higher administrative costs plus profit on top of that. And if you are going to save any money through what Governor Romney is proposing, what has to happen is that the money has to come from somewhere. And when you move to a voucher system, you are putting seniors at the mercy of those insurance companies. And over time, if traditional Medicare has decayed or fallen apart, then they're stuck. And this is the reason why AARP has said that your plan will weaken Medicare substantially. And that's why they were supportive of the approach that we take. One last point I want to make. We do have to lower the cost of health care. Not just in Medicare, but overall. And so
That's a big topic. Let's get back to Medicare. The president said that the government can provide the service at low cost and without a profit. If that's the case, then it will always be the best product that people will purchase. My experience is the private sector typically is able to provide a better product at a lower cost.
Can the two of you agree that the voters have a choice, a clear choice between you on Medicare? So, to take briefly on the economy, what is your view about the level of federal regulation of the economy right now? Is there too much? And in your case, as the president, should there be more? Beginning with you. It's about a 2-minute session to start. We'll go for a few minutes and then we're going to go. Okay?
Regulation is essential. You can't have a free market if you can't have regulation. As a business person, I had to have regulation. I need to know the regulations. I needed them there. You couldn't have people opening up banks in their garage and making loans. You have to have regulations so that you can have an economy, and every free economy has good regulation. At the same time, regulation can become excessive.
Is it excessive now?
In some places, yes. In other places, no. It can become out of date. And what's happened with some of the legislation that's been passed during the president's term, you've seen regulation become excessive, and it's hurt the economy. Let me give you an example. The Dodd-Frank was passed. It includes a number of provisions that I think has some unintended consequences that are harmful to the economy. One is it designates a number of banks as too big to fail, and they're effectively guaranteed by the federal government. This is the biggest kiss that's been extended to New York banks I've ever seen. This is an enormous boon for them. There have been 123 community and small banks and closed since Dodd-Frank. There's one example. Here's another. In Dodd-Frank, it's
Is it repealed, Dodd-Frank?
well, you would repeal it and replace it. You're not going to get rid of all regulation. You have to have regulation. And there's some parts of Dodd-Frank that make all the sense in the world. You need transparency. You need to have the leverage limits. And it's very specific. Let's
respond to this specific on Dodd-Frank and what the governor just said.
I think this is a great example. The reason we have been in such an enormous economic crisis was prompted by reckless behavior across the board. Now, it wasn't just on Wall Street. You had loan officers that were given loans and mortgages that really shouldn't have been given because the folks didn't qualify. You had people who were borrowing money to buy houses that they couldn't afford. You had credit agencies that were stamping these as A1 great investments when they weren't. But you also had banks making money hand over fist exist, churning out products that the bankers themselves didn't even understand, in order to make big profits, but knowing that it made the entire system vulnerable. So we stepped in, and one of the toughest reforms on Wall Street since 1930. We said you've got banks, you've got to raise your capital requirements. You can't engage in some of this risky behavior that's most free at risk. We want to make sure that you've got to have a living will, so we can know how you're going to wind things down if you make a bad bet, so we don't have other taxpayer bailouts. In the meantime, by the way, we also made sure that all the help that we provided those banks was paid back every single dime with interest. Now, Governor Romney has said he wants to repeal Dodd-Frank, and I appreciate, and it appears we've got some agreement that the marketplace to work has to have some regulation. But in the past, Governor Romney said he just wants to repeal Dodd-Frank. And so the question is, does anybody out there think that the big problem we had is that there was too much oversight and regulation of Wall Street? Because if you do, is your candidate.
I want to play with cartoon, Dada.
Sorry,
I want to play with cartoon.
This is not the facts.
I
Yet
want to
we
play
have
with
to have
cartoon, Dada.
regulation on Wall Street. That's why I have
You want to play guitar
regulation.
too?
I wouldn't designate five banks as too big to fail and give them a blank check. That's one of the unintended consequences of Dodd-Frank. It wasn't thought through properly. We need to get rid of that provision because it's killing small banks. Let me mention another regulation.
I know how to do that.
It's exactly right. Financial calamity we had. And so Dodd-Frank correctly says we need to qualify mortgages, and if you give a mortgage that's not qualified, there are big penalties. Except they didn't ever want to define what a qualified mortgage was. It's been 2 years. We don't know what a qualified mortgage is. So banks are reluctant to make loans, mortgages, trying to it's hurt the housing market because Dodd-Frank didn't anticipate putting in place the kind of regulations you have to have. It's not that Dodd-Frank always was wrong with too much regulation. Sometimes they didn't come up with a clear regulation. I will make sure we don't hurt the functioning of our marketplace. I want to bring back
housing. Now let's move to healthcare, where I know there is a clear gap, and that has to do with the Affordable Care Act of Obamacare, and it's a 2-minute new segment, and it's 2 minutes each. You go first, Governor Romney. You want it repealed. You want the Affordable Care Act repealed.
I sure do. Well, in part, it comes again from my experience. I was in New Hampshire. A woman came to me and she said, look, I can't afford insurance for myself or my son. I met a couple in Appleton, Wisconsin, and they said, we're thinking of dropping our insurance. We can't afford it. And the number of small businesses I've gone to that are saying they're dropping insurance because they can't afford it, the cost of health care is just prohibitive. And we've got to deal with costs. And unfortunately, when you look at Obamacare, the Congressional Budget Office has said it will cost $2,500 a year more than traditional insurance. So it's adding the cost. And as a matter of fact, that by this year he would have brought down the cost of insurance for $2,500 a family. Instead, it's that amount. So it's expensive things hurt families. So that's one reason I want. Second reason, $716 billion Medicare to pay for it.
You want a pony ride?
Medicare for our seniors.
Then you'll go night-night?
Number 3, it puts in place an unelected board.
If
It's going to tell
you
people ultimately what kind of
want
treatments
a
they can
diet,
Who's winning the debate?
me.
You are?
There was a survey done of small businesses across the country. It said, what's been the effect of Obamacare on your hiring plans? And 3/4 of them said it makes us less likely to hire people. I just don't know how the president could have come into office facing 23 million people out of work, rising unemployment, an economic crisis at the kitchen table, and spent his energy and passion for 2 years fighting for Obamacare instead of fighting for jobs for the American people. It has killed jobs. And the best course for health care is to do what we do in my state, craft a plan at the state level that fits the needs of the state. And then let's focus on bringing the cost down for people rather than raising it with the $2,500 additional premium.
President, the argument against repeal.
Well, 4 years ago when I was running for office, I was traveling around and having those same conversations that Governor Romney talks about. And it wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall health care costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. They had a pre-existing condition. They might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit. And so as a consequence, they're paying their premiums. Somebody gets really sick. Lo and behold, they don't have enough money to pay the bills because the insurance companies say that they hit the limit. So we did work on this alongside working on jobs because this is part of making sure that middle-class families are secure in this country. And let me tell you exactly what Obamacare did. Number one, if you've got health insurance, it doesn't mean a government takeover. You keep your own insurance, you keep your own doctor, but it does say insurance companies can't jerk you around. They can't impose arbitrary lifetime limits. They have to let you keep your kid on your insurance plan until you're 26 years old. And it also says that you're going to have to get rebates if insurance companies are spending more on administrative costs and profits than they are on actual care. Number two, if you don't have health insurance, we're essentially setting up a group plan that allows you to benefit from group rates that are typically 18% lower than if you're out there trying to get insurance on the individual market. Now, the last point I'd make before
minutes is up, sir.
No, I think I had 5 seconds before you interrupted me. Was the irony is that we've seen this model work really well in Massachusetts because Governor Romney did a good thing, working with Democrats in the state to set up what is essentially the identical model, and as a consequence, people are covered there. It hasn't destroyed jobs, and as a consequence, we now have a system in which we have the opportunity to start bringing down costs as opposed to just leaving millions of people out in the cold.
Your 5 seconds went away.
You're saying total Obamacare is wrong, correct? Supposedly are shady, man.
First of all, I like the way we did in Massachusetts. I like the fact that in my state we have Republicans and Democrats come together and work together. What you can said was to push this down without a single Republican vote. As a matter of fact, when Massachusetts did something quite extraordinary, elected a Republican senator to stop Obamacare, we pushed it through anyway. So entirely on a partisan basis, instead of bringing America together and having a discussion on this important topic, he pushed through something that you and Nancy Pelosi and Harry Reid thought was the best answer and drove it through. What we did in the legislature, 87% Democrat. We were together, 200 legislators in my legislature. 22 voted against the plan by the time we were
Super loud.
What were some differences? We had raised taxes. We raised them by $1 billion under Obamacare. We didn't cut Medicare. Of course, we don't have Medicare, but we didn't cut Medicare by $716 billion. We didn't put in place some so people ultimately what treatments they're going to receive. We didn't also do something that I think a number of people across this country recognize, which is put people in a position where they're going to lose the insurance they had and they wanted. Right now, the CBO says up to 20 million people will lose their insurance, and Obamacare goes into effect next year. And likewise, a study by the company anticipating dropping people from coverage. So for those reasons, for the tax, for Medicare, for this board, and for people losing their insurance, this is why the American people don't want Medicare. They want Obamacare. It's why Republicans say, do not do this, and the Republicans had a plan. They put a plan. They put a plan, a bipartisan plan. It was swept aside. I think something this big, this important, has to be done on a bipartisan basis. And we have to have a president who can reach across the aisle and fashion important legislation with the input from both parties.
Governor Romney said, is that has to be done on a bipartisan basis. This was a bipartisan idea. I think it was a Republican idea. And Governor Romney, at the beginning of this debate, wrote and said, what we did in Massachusetts could be a model for the nation. And I agree that the Democratic legislators in Massachusetts might have given some advice to Republicans in Congress about how to cooperate. But the fact of the matter is, we use the same advisors, and they say it's the same plan. When Governor Romney talks about this board, for example, unelected board that we've created. What this is a group of healthcare experts, doctors, etc., to figure out how can we reduce the cost of care in the system overall. Because there are two ways of dealing with our healthcare crisis. One is to simply leave a whole bunch of people uninsured and let them fend for themselves. To let businesses figure out how long they can continue to pay premiums until finally they just give up and their workers are no longer getting insured. And that's been the trend line. Alternatively, we can figure out how do we make the cost of care more effective. And there are ways of doing it. So at Cleveland Clinic, one of the best healthcare systems in the world, they actually provide great care cheaper than average. And the reason they do is because they do some smart things. They say, if a patient's coming in, let's get all the doctors together at once, do one test instead of having the patient run around with 10 tests. Let's make sure that we're providing preventive care, so we're catching the onset of something like diabetes. Let's pay providers on the basis of performance as opposed to on the basis of how many
Doctor!
Sorry.
I need to play a game.
Identifies best practices.
I love you.
I need to play a game.
Our Medicare and Medicaid
He's a night-night.
help to institutionalize all these good things that
I
we
need
do.
to play
This
a
debate
game.
sucks!
That
Attack him.
Obamacare is fully implemented, we're going to be in a position to show costs are going down. And over the last 2 years, healthcare premiums have gone up. It's true, but they've gone up slower than any time in the last 50 years.
I'm gonna hear the zingers.
We're already beginning to see progress.
You wanna hear the zingers?
Yeah.
With insurance, you're already getting a rebate. Let me make one last point. Governor Romney says we should replace it. I'm just going to repeat it, but we can replace it with something. But the problem is he hasn't described what exactly we'd replace it with, other than saying we're going to leave it to the states. But the fact of the matter is that some of the prescriptions that he's offered, like letting you buy insurance across state lines, there's no indication that that somehow is going to help somebody who's got a pre-existing condition be able to finally buy insurance. In fact, it's estimated that by repealing Obamacare, you're looking at 50 million people losing health insurance at a time when it's vitally important.
Let's let the governor explain what you would do if Obamacare is repealed. How would you replace it?
Well, actually, it's a lengthy description, but number one, pre-existing conditions are covered under my plan. Number two, young people are able to stay on their family plan. That's already offered in the private marketplace. You don't even have the government mandate that for that to occur. But let's get back to something the President and I agree on, which is the key task we have in healthcare is to get the cost down so it's more affordable for families. And he has as a model for doing that a board of in my opinion, the government is not effective in bringing down the cost of almost anything. As a matter of fact, free people and free enterprises trying to find ways to do things better are able to be more effective in bringing down the cost than the government will ever be. Your example of the Cleveland Clinic is my case in point, along with several others I could describe. This is the private market. These are enterprises competing with each other, learning how to do better and better jobs. I used to consult businesses, the hospitals and the healthcare providers. I was astonished at the creativity and innovation that exists in the American people. In order to bring the cost of healthcare down, we don't need to have a board of 15 people telling us what kind of treatments we should have. We instead need to put insurance plans, providers, hospitals, doctors,
Daddy, Doctor, we play a game.
performance pay for doing an excellent job for keeping costs down, and that's happening. Intermountain Healthcare
Yeah,
does it
this one.
superbly well. Mayo Clinic is doing it superbly well. Cleveland Clinic, others. But the right answer is not to have the federal government take over healthcare and start mandating to the providers across America, telling a patient and a doctor what kind of treatment they can have. That's the wrong way to go. The private market and individual responsibility always work best.
Let me just point out, first of all, this board that we're talking about can't make decisions about what treatments are given. That's strictly prohibited in the law. But let's go back to what Governor Romney indicated, that under this plan, he would be able to people with pre-existing conditions.
How do you got this thing playing music?
Well, actually,
I know wobbly mirror.
that isn't what your plan does. What your plan does is to duplicate what's already the law, which says if you are out of health insurance for 3 months, then you can end up getting continuous coverage. And insurance company can't deny it if you've been under 90 days. But that's already the law, and that doesn't help the millions of people out there with pre-existing conditions. There's a reason why Governor Romney set up the plan that he did in Massachusetts. It wasn't a government takeover of healthcare. It was the latest expansion of private insurance. But what it does say is that insurers, you got to take everybody. Now, that also means that you get more customers. But when Governor Romney says that he'll replace it with something, but can't detail how it will be in fact replaced, and the reason he set up the system he did in Massachusetts because there isn't a better way of dealing with the pre-existing condition problem. It just reminds me of, he says that he's going to close deductions and loopholes for his tax plan. That's how it's going to be straightforward. We don't know the details. He says that he's going to replace Wall Street reform. We don't know exactly which ones. He won't tell us. He now says he's going to replace Obamacare and assure that all the good things that are in it will be in there, and you don't have to worry. And at some point, I think people have to ask themselves, is the reason that Governor Romney is keeping all these plans to replace secret because they're too good? Is it because that somehow middle-class families are going to benefit too much from them? No, the reason is because when we reform Wall Street, when we tackle the problem of pre-existing conditions, these are tough problems, and we've got to make choices. And the choices we make are the ones that ultimately are benefiting middle-class families all across the country.
We're going to move to
which is my experience as a governor. Is if I come in and lay down a piece of legislation and say it's my way or the highway, I don't get a lot done. What I do is the same way that Tip O'Neill and Ronald Reagan worked together some years ago. When Ronald Reagan ran for office, he laid out the principles that he was going to foster. He said he was going to lower tax rates. He said he was going to broaden the base. You said the same thing. You're going to simplify the tax code, broaden the base. Those are my principles. I want to bring down the tax burden on middle-income families. And I'm going to work together with Congress to say, okay, what are the various ways we could bring down deductions, for instance? One way, for instance, would be to have a single number. To make up a number, $25,000, $50,000. Anybody can have deductions up to that amount. And then that number disappears for high-income people. That's one way one could do it. One could follow Bowles-Simpson as a model and take deduction by deduction and make differences that way.
I need to play my game.
Alternatives to accomplish the objective I have, which is to bring down rates, broaden the base, simplify the code, and create incentives for growth. And with regards to health care, you have remarkable details with regards to my pre-existing condition plan. You obviously studied up on my plan. In fact, I do have a plan that deals with people with pre-existing conditions. That's part of my health care plan. And what we did in Massachusetts is
She did that? It might mirror to don't do. It might you.
No.
It might mirror. Dada, give me that ball. Give me that.
No, you're going to like gambling site.
I don't want
And
that.
it's playing music.
I don't want to mirror.
I'm gonna turn it off.
and it's the role of the government, and it is.
I don't want to.
Mr. President, and the question is.
Hold on, I'm trying to listen to this. Both these guys suck, man. I
Yeah, I don't want to. can't put your
Any
boo.
difference between the two of you
You can't.
as to how you view the mission of the federal government?
Well,
Is it coming back on? There it comes.
Keep the American people safe. That's its most basic function.
It's dead.
And, as Commander-in-Chief,
It died.
something that I have
Alright, let's just go back.
No.
You want to finish watching the debate?
I also believe that
You're not even watching it.
has the capacity
You don't even know who that is. Who is that?
No, I know why. Oh, sleepy.
Alright, we're going back.
where the American people